Hi, everyone, and welcome to Population Health Matters live stream. This is Heluna Health's live stream series. We're so glad you could tune in today. My name is Sarah Lichman, and I'm the Director of Media Strategy at Heluna Health. Before we get started, I want to remind those of you who are joining us live that we'll be reserving about 10 minutes towards the end of the live stream for a Q&A session. So please feel free to submit any questions in the live stream chat. Today's topic is Black maternal health, which is in crisis in the United States. According to CDC data, Black women are nearly 3 times more likely to die from pregnancy-related complications than white women. Black birthing people are also more likely to experience life-threatening conditions associated with pregnancy, like blood clots or preeclampsia. Centuries of structural and systemic racism have limited Black families' access to critical resources and care. But there's hope, and I'm joined today by 3 brilliant women who are working to make a positive difference and change those statistics. First, I'd like to welcome Dr. Renaisa Anthony. Dr. Anthony is a Harvard and University of Chicago trained physician, public health practitioner, and innovator, and the founder of Momentum Park, an organization committed to optimizing the health, lives, and well-being of moms-to-be and their babies through the integration of medicine, public health, and the prioritization of technology to disrupt the status quo of maternity care. She founded Momentum Park as her proclaimed soul work and labor of love after working 2 decades in traditional healthcare and academic sectors. Dr. Anthony is dedicated to health equity by improving the health and lives of underserved and low-resource communities through medicine, public health, policy, and technology. She built Momentum Park to continue and expand these decades-long efforts. With 15 years of interdisciplinary experience in medicine, public health, administrative leadership, academics, health policy, and social entrepreneurship, her areas of expertise include maternal child health, women's health, health disparities and equity, community engagement, partnerships, diversity, inclusion and equity, and technology. Dr. Anthony was born premature to a single mother in one of the poorest zip codes in Detroit and is personally and professionally dedicated to advancing equity and justice. She is a proud and active fur mom of 3 Yorkshire Terriers. So welcome, Dr. Anthony. Next, I'd like to welcome Marlee-I Mystic, who is the Director of Doula Programs at SisterWeb San Francisco Community Doula Network. Marlee-I is a San Francisco native with a strong holistic and spiritual background. She was 12 years old when she attended her first birth. It was an amazing experience and convinced her she wanted to work with mothers and their babies. After receiving a degree in psychology and communication from UC Davis, she returned to the Bay Area to work in nonprofits in hopes of uplifting her community. She received doula training in 2012 and supports growing families with perinatal care. She is a devoted mother of 2 daughters and provides meditation, sound healing, wellness, and intentional parenting services. Her journey with SisterWeb began in the very early days as one of the original Kindred Birth Companions doulas. Now serving as the Director of Doula Programs, she is happy to continue providing doula support to Black and Brown families and elevate the job of doula to the respectable career path that it is. Welcome, Marlee-I. I'd also like to welcome Dr. Melissa Franklin, who is the Director of Maternal, Child, and Adolescent Health for the Los Angeles County Department of Public Health's Health Promotion Bureau. Dr. Franklin is a public health leader with over 25 years of experience in organizational development and communications for both public health and public education. She entered the work of supporting communities after she lost 300 colleagues in the 9/11 terrorist attacks while working in private industry. That horrific event placed within her a desire to dedicate her life to making a positive impact in communities. Since then, her life's work has focused on transforming systems. Dr. Franklin was appointed to her current role in November 2022, making her the first Black woman director of the division for LA County. In this capacity, she oversees programs that support the health and well-being of pregnant individuals, infants, and children, including the African American Infant and Maternal Mortality Prevention Initiative, which she helped launch in 2018 as a Pritzker Fellow, Black Infant Health Program, Asthma Coalition, Childhood Lead Poisoning Prevention Program, Help Me Grow, home visitation programs, and positive youth development. Before joining the LA County Department of Public Health, Dr. Franklin consulted on the launch of initiatives for a variety of organizations, including the Bezos Foundation, Pritzker Foundation, the California WIC Association, PHFE WIC, and many others. She also has experience in communications and stakeholder engagement within the education sector. Dr. Franklin earned a Doctor of Education in Organizational Change and Leadership from the University of Southern California, a Master of Business Administration, and Bachelor of Arts in Business from Loyola Marymount University. Her doctoral studies focused on achieving breakthroughs in equity through the efforts of collaborative groups. The implementation of the recommendations from her dissertation won funding from the Gates Foundation. She is a mother of two who brings to her work her own story of birth trauma and inequity. Welcome, Dr. Franklin. So I'm so pleased to have all three of you here with us today. I know I touched a little bit on the work each of you do in the introductions, but I'm hoping we can go around and each of you share just a little bit more about your organizations and how they're rising to meet some of the challenges in Black maternal health.
Sure. Thank you so much, Sarah, for the beautiful introductions. Just so proud to be on this panel with such amazing, innovators in the world and change agents for mamas and babies. And for everyone who's out there, it is officially Black Maternal Health Week. So excited. I am the founder of Momentum Park, where moms come first and every moment matters. And our signature program and initiative to address maternal mortality and infant mortality across the United States is SHERO. Hello, everyone out there with SHERO. It stands for Shaping Healthy, Equitable Reproductive Outcomes. We prioritize technology and marry it with community engagement, leveraging the insights and the love of our community health workers, our doulas, and our maternal and child health professionals on the ground from a grassroots level. And I'm in Silicon Valley. We provide the tech to equip them to be able to serve our mamas and babies. And so super excited to be here. Thanks.
Yes, and I over at SisterWeb, we are providing free doulas to Black families here birthing and living in San Francisco. We provide them mentorship and continued education. We also hire these doulas as full-time employed and benefited people so that they have time to take off and it's no longer a side hustle like it is for so many doulas. And our goal is to really dismantle racist systems and to help build up this view of doula and this kind of work to be something that is valued across the board. So we center and uplift Black families. We make sure that we have communication in our champion dyad with our birthing locations here in San Francisco and build that community of birth worker beyond just the community into the birthing places. And our goal is to really provide this care for Black families because we know that they are still experiencing these difficulties in birthing. And we want to be there for the doulas. We want to be their consistent care and their culturally congruent care. And we've been doing this for a little over 5 years now and have made a great impact in San Francisco and are so happy to be here today for this conversation. Thank you.
I echo that joy at being here. Thank you so much for the introduction, Sarah, and just how amazing to be on a panel with two just dope change makers. And it gives me such great encouragement to be in this work, which is a hard work, as you all know, but also a heart work, a soul work, as I heard in Dr. Anthony's bio as well. So it's such an honor to be here with the LA County Department of Public Health, as you had heard. And I did want to highlight our Los Angeles County African American Infant and Maternal Mortality Prevention Initiative and its close sister in the work, the Black Infant Health Program. They are the county's response to the crisis of Black pregnancy and birthing inequity in our county. Similar to the CDC's data, Black women die at 4 to 5 times the rate of any other race, 3 to 4 times the rate of any other race in our county due to pregnancy related complications and childbirth. And Black infants die at 3 times the rate of any other race before their first birthday. The AIM Prevention Initiative was launched by DPH, or LA County Department of Public Health, in partnership with First 5 LA, along with other county departments in 2018, mental health care providers, funders, community members, and we bring together a unique county community partnership to address birth outcome inequality. The initiative is guided by the shared vision of Black women, birthing persons up front and leading, and addressing the problem from a lens of racism as a root cause and being upfront with that. Greatly appreciative to our department director, Dr. Ferrer, and the LA County Board of Supervisors for making that a priority, looking at racism as the root cause and placing an emphasis on addressing the behavior of the system versus the behavior of the individuals. And our outcomes are joy, justice, healing, and breakthrough births for our Black families. We have several programs, AIM Doula program, which provides free doula support to Black families, community action teams across our county, Expectant Fathers Group, Black Daddy Dialogue Support Group, a village fund that invests in organizations who are working in communities, system change efforts with local hospitals, Black Maternal Health Center of Excellence at our Charles Drew University, and the Black Infant Health Program, of course. And I wanted to uplift the AIM Doula program in particular, who provides doula services to Black women and birthing people at no cost, delivered by community doulas who are just an amazing, profound, and long-standing intervention, as they call it, in our county and our state, and so proud to be here with SisterWeb as well. And then we have a steering committee and community action teams and just partnerships with CBOs. And our goal is joyous and just Black births, that is possible for our people, and that it is deserving of our focus, our intention, and our funding. So thank you all for having me here today.
Wonderful. Well, as we discussed, Black Maternal Health Week begins this Thursday, April 11th, and the theme has to do with reproductive justice, and it focuses on issues that are on the ballot this year in so many places. I'd like to know from each of your perspectives, what are you seeing when it comes to these issues, and how does it affect your work?
I'm happy to jump in. I know my Shiro Nola team is on with us live. New Orleans, for instance, thanks to the reversal of Roe v. Wade, has a full trigger ban for termination. So that means we have a lot more birthing people. We have a lot more soon-to-be mothers, some who didn't necessarily want to be mothers, but they also need to receive care, prenatal care. And what we're finding in New Orleans is that they put in this policy, but they didn't support it with, say, for instance, an increase in obstetric services or providers. So now a lot of women, even those who have chosen and said, I want to be a mom, they can't even get in that first trimester to see a provider. So they're pushing people out beyond 12 weeks to be seen. The volume of those who are pregnant has significantly gone up, yet the supply of providers has not. And that becomes a huge problem, regardless of how you feel about the pro-life, pro-choice, or abortion in general. The reality is that when women are pregnant, they are going to need those services and that support. And if it's not there, that's a problem. And that's why Shiro's come in, especially our New Orleans team, to make sure that those moms get the love and support that they need, that they have advocates, regardless if they've chosen to be moms or by default, they have to be moms because the state in which they live in, that we're there to support them until they can basically safely bring them from their pregnancy into parenthood. And we do that through our sisterhood.
I think you mentioned a great point in that, because when it comes to investing in those programs that moms need, I'm here in California, in San Francisco. We're very liberal. We have, thankfully, not too many laws that are, about what we can and cannot do with our body. But the funding the federal grants, those things that actually come to support and help the team of birth workers, that is also impacted when you're dealing with politics, when you're dealing with what are we going to invest our time in. We want everybody to have babies, but we're not going to pay for more community doula programs. We're not going to expand the funding that's available to create these programs. And when we're thinking about what Dr. Franklin said in regards to using racism as a base of the issue, will we be able to use those type of things when we're trying to take DEI out of, the curriculum? We're trying to take that out of ways in which we can fund. How is that going to impact the work that we're doing that we know is directly related to implicit bias and racism? And we know as the climate of differences gets wider and wider, and we have, a more heightened sense of what race is and what it isn't, those implicit bias come out more in the work that you do. Everyone's more heightened. And so I definitely have some concerns in regards of which way we're going and how that's going to impact our clients, how that's going to impact our doulas who are working in these systems each and every day. How will they be treated? How will they be seen? Because I come from a past of knowing that you can enter into these spaces and they be friendly, or you can enter into these spaces and it seems very combative. And so as we enter, we know we've seen how combative things can be, even in the medical system with COVID, with, parallel lines being drawn to keep people out and in. And so I just hope that we continue to broaden our awareness and broaden our understanding to know that this work is worth being invested in, and that we should continue to have more organizations that are doing more care. And also, like Dr. Franklin down in LA, having all those different aspects of care, because a doula can't do it. Momentum can't do everything. We need more and more of these kinds of organizations to support the people who are out there dealing with this every day.
And with policies, being able to protect those policies. We have our Shira Omaha team online right now, and thankfully they passed legislation in Nebraska for doulas to be compensated. Yet there are folks coming in and saying, okay, well, they need to be certified, and they can only be certified by these organizations. And when you look at the organizations that some of these third-party payers or Medicaid groups are saying you have to be certified, when you call and you look, it's a 2-year process, $5,000, $6,000, these things that are prohibitive. And then you look at the history of midwifery and what happened there. We're starting to see that translate also in what's becoming the history of doulas. So being able to support that a woman who can do the work or a birth worker who can do the work should be able to be compensated at the end of the day, and not all these restrictions that are being put on these policies that can really, really change the outcomes that we're seeing for Black moms and babies.
I really feel like we're just starting to scratch the surface of a country, a state, county being willing to focus on the inequitable death and dying of Black folks, which in some ways is very encouraging. It gives me great hope. It's inspirational. I mean, it's, I always say the doulas as a Medi-Cal covered benefit in large part came from the efforts of doulas who have been doing this work for a long time, sacrificing, making it work, taking on clients free, and on the death and dying of Black folks, which are highlighted in our county and in our nation. What gives me concern is the lack of interest of really leaning into that once we start talking about heightened resources or funding or programming specifically focused on Black folks, that there is a problem, that our death and dying isn't enough to lean in. And so that concerns me in terms of, the tension in our country and in our state. Where I find hope in the work of the people on the ground, coming together, locking arms, and making it happen in those agencies that are willing to step forward and support and stand behind race-conscious policies, and in philanthropic organizations that are investing in that. It's just that more needs to be done if we are truly going to see a change or a transformation, not only in the outcomes, which we all are hoping for, in terms of decreased infant and maternal mortality, but also the outcomes in terms of the experiences of Black birthing folks in our systems, which will benefit absolutely every race in our county and in our nation. If we can do better by Black folks in our systems of care, all others benefit as well.
That's great. And Dr. Franklin, you touched on something that I wanted to get to, which is that, overall, the picture can look really grim if you are looking at the statistics, and particularly the recent statistics. And I know all three of you are kind of on the front lines, so to speak, of working to change those statistics. But I want to hear from each of you really what gives you hope and what keeps you going every day. Oh, Dr. Anthony, I think you're muted.
I have an amazing team that gives me hope every day. So as much as I like to say I self-identify with still being 30 or 35, the reality is that I'm not. And our success really relies on bringing into our team fold those who represent reproductive age women. And so when I see these younger women who are on fire for making a difference, whether that's because they've had their own personal birth trauma stories or their daughters have those stories, or on the other hand, I've had some that have amazing birth stories and they just wish every single person would have had this experience, that I know that the future is in their hands, that my succession plan is in their hands, and that they're being mentored and going out to make a difference really gives me hope. The other piece that gives me hope is that as Black and brown folks, we've always figured it out. We've always figured it out. We know how to take $1 and make it into 5. And those of us who are resourceful can turn it into 10. Whether it's my great-grandmother, I come from a long line of birthing people. My great-grandmother was a midwife. My grandmother was a labor and delivery nurse at one of the first integrated hospitals in the South. My aunt was a labor and delivery nurse. And I'm one of the first obstetricians in the family. And their stories, when Black women had to deliver in Black wards, it's amazing to me that their outcomes were actually better than when we integrated them. And it's not because integration doesn't make a difference. It does. It's because of some of the things that we've been talking about implicit and unconscious bias and racism, all those things that are structural. But those structures have always been there. Thankfully, I think they're getting a little better, but we've figured it out. And so I always say when I am talking to funders is that we can do a lot more with less, but we shouldn't have to do as much as we do with less. And so I'm really excited about the funders, the philanthropists, and the opportunities to really allow these kind of who I call the underdogs to be able to go out into the community and really make a difference, because we always do and we always figure it out.
Yeah, I like to piggyback on that because you brought up this idea of more awareness and bringing in the younger generation. And I think what brings me hope is that there is more awareness. I mean, Black people have been suffering in silence without the statistics for a long time. And so being able to have the data, being able to show specifically and directly what is happening to us really helps us to plead that case, to say, hey, this suffering does matter. This death does matter. And so bringing it to light, though it may be hard information to swallow, it may be something that puts some fear into people into wanting to even have babies and go, through the birthing process. But I think the fact that we have this light shined on it brings us out of the darkness and into that marvelous light, so that we can say, hey, this is what's happening. This is the places where we can get folks in to help and to do the work and to make the change, to change those systems and those structures. And so there's no way to do it when it's in secret, when it's not talked about. And so I think the more that we talk about it, the more that we're able to get on platforms like this and bring awareness, gives me hope. And it also gives me just an upliftment in my spirit to be able to say, I can say this stuff out loud and people are listening. People aren't saying, oh no, because I still run into those people at a cocktail party who say, oh, why do you need doulas? You know, why do you need this? And I'm able to say, well, did you know that Black women are 3 to 4 times more likely to die? And they're like, where? Not here. Yes, here. And so to be able to bring this out, to be able to say, well, go back and watch that video on this, go back and watch that movie, go back and watch this documentary. And it's not just me passing along DVDs like it was before, but it's really accessible to people. That brings me hope, because it does fuel the fire of that next generation to come on through and make a change and stand up for what needs to be different.
That's really great. I'm just a reminder to our audience, if you're watching live, that if you have any questions for our panelists, you can go ahead and drop those in the chat. I want to switch gears here and take a couple of those questions. We've had one come in, and the question is, I'm not sure who it's for, but I think Marlee-I, maybe you might be able to answer this. Can you elaborate more on the role of doulas in creating better birth outcomes?
Yeah, so, doulas are support people. They are not medical doctors or medical professionals or clinicians, even though oftentimes we are put into that space when we're in the hospitals and in the birthing situations. But it has been shown that there are decreases in epidural usage when you have a doula present. There is a decrease in interventions that take place. So doulas provide benefits emotionally, physically, and even clinically, with the reduced Pitocin, fewer requests for pain medicine, less likely to need that vacuum or forceps, and even better APGAR scores are happening when you have a doula in the space. And so I like to think of a doula as like a coach. They're there to give you the education, information that you need to prepare yourself for that birth journey prenatally. They are there with you throughout the duration of your labor and delivery and support you postpartum. For a lot of people, that is the most consistent care that they're going to get. Even if they have providers, you may see one provider throughout your whole pregnancy, and then the birth comes and you're with whoever is on call that night. But you have that consistent person with you, that continuity of care that's happening with the doula. And they are informed, they've seen births, they've seen natural births a lot more times than often your doctor has. And so they know what to expect and to normalize it for you. In that sense, they decrease anxiety and increase confidence, help to boost your self-esteem when you're in that moment, and provide just a improved mental health situation when you're in there. So it's about the quality of the care. It's about your physical body in preparation and in healing, and just having a doula there to support you is like having a professional walk you through those steps as you really go through one of the most amazing experiences that there is in this life.
That's really wonderful. Well, I know we're at about time and we're going to have to wrap up here shortly, but before we go, I want to ask each of you to share where our viewers can keep up with your work, and if you have any last minute thoughts or words of wisdom that you'd like to share.
I will start. They can keep up with our African American Infant and Maternal Mortality Prevention Initiative on blackinfantsandfamilies.org or BIFLA on our social media platforms. Of course, there's the LA County Public Health website, but Black Infants and Families will take you there. And final words for folks really is related to some of the root causes that we were talking about. Black folks presenting more vulnerable in childbirth and pregnancy, and that is because of centuries of oppression, of slavery, of being torn from our families, and then continued failures of our systems to treat us with dignity and respect. And I want to highlight that, not because there isn't hope, just so that even if you're not in the work of providing health supportive services to treat Black folks better in the lives around you. Become educated, address your own biases and prejudices, and see opportunities to uplift your fellow human being and not contribute to racism, racist practices.
Amen. That deserves an amen. So let it be, because I think that's our wish for all of us. For us at SisterWeb, you can find us at sisterweb.org and online at SisterWeb Doulas. We will be having a doula training this summer. So if you're around in the San Francisco Bay Area, keep a lookout for that. That is free of charge. Our goal is to bring more doulas into the space, especially before they start mandating it to be some type of certification from somewhere specific. We want to get that information out there. Even if you're not going to use your doula as a profession or as a career, this is knowledge that we all need to have. If you're an auntie, if you're a mama, if you're a daddy, if you're a brother, if you have someone who may be birthing in your life, it is great to get that information so that we can all advocate and be a support for our mamas and for our babies. So check us out, and hopefully we'll have some good resources for you coming up as we get into this doula training.
Yes. You can find us at momentumpark.org. You can also find us on Instagram, momentumpark_park. You can follow our Shiro groups. We're Shiro_NOLA, Shiro_Omaha. And my parting words would be to join us. We do have a Mother's Day kind of celebration, a moment for moms on May 8th. So I want to get that out there. And you can find us and get our personal invite if you email us at info@momentumpark.org. Lastly, I guess it takes a village. It takes a village to not just raise a child, but it takes a village to have a healthy, thriving mama so she can have a healthy, thriving baby. And so I would say to you, even if you're not directly doing this work, that you know somebody who is either expecting or recently had a child, check in, see what they need. Even if in a pack of diapers or just saying, hey, I'm here if you need me to run to the grocery store. Collectively, we can make a difference, because at one time, that's all we had, right? That's all we had was each other. So reach out. It's about community.
Thank you. Those are really great words. And, this has been too short. I really would love to talk to you all day, but we have to wrap it up here. It's really been an honor to host this discussion and to hear all of your perspectives. Thank you so much, Marlee-I, Dr. Anthony, and Dr. Franklin for sharing with us today. And thank you to our audience, whether you joined us live or are watching the recorded version of this. Thanks for tuning in. Please make sure you're following Heluna Health on social media. We are on Facebook, Instagram, X, and LinkedIn. And have a wonderful rest of your week.